My name is Alex. I am a husband, I'm a father, I'm a musician, and 2 years ago, I was diagnosed with aTTP. My first experience with aTTP was pretty scary. I was on my way to work, and then half of my body went numb. So I drove myself to the urgent care, and they basically said, it sounds like you had a mini stroke. You might want to go to the ER because there's nothing we can do for you. The first time I was in the hospital, I had a very extended stay. Not knowing what's wrong with you, it's just so frightening. You know, they're testing for so many things and everything comes back negative. My platelet count kept going down. It just wasn't improving. You know, having all these doctors around you that look kind of concerned because they can't figure out what's wrong with you. You sort of want to keep hope, but you somehow also start beginning to lose hope. All you can do is just be patient and hope that, you know, they figure it out. He finally diagnosed me with aTTP. I just felt so relieved that they finally figured out what was wrong. On my second experience with aTTP, my new doctor mentioned that there was a medication that could be helpful for me called CABLIVI. Once I had aTTP again, my main concern was bringing up my platelet counts. So learning that CABLIVI, along with immunosuppressants and plasma exchange, could help bring my platelet count to a normal level faster, it's like, okay, let's do this. What do we do? What's the treatment plan? The only thing I could think about then was just, you know, being home with my family, my music career. I just wanted things back the way they were. Within 3 days of starting CABLIVI, my platelet count returned to a normal level. After 7 days, I was well enough to go home. My doctor explained that taking CABLIVI had certain side effects, but thankfully I didn't experience any. Once I was released from the hospital and I continued my medication at home, I had no issues with self-injecting. Or the nurses at the hospital showed me how to do it, and I was confident that I could do it at home. I didn't have any relapses during my CABLIVI treatment or for 28 days after. So my life today is just staying on top of my symptoms. I just feel more confident, and I was ready to move forward with my life. Appreciate my family, my music career. I can do the things that I wanted to do and still live a fulfilling life, even if I'm living with aTTP.
This was Alex's personal experience with CABLIVI. Every patient's experience is unique, and individual results will vary. If you are interested in learning more, please speak with your doctor about the potential benefits and risks of treatment with CABLIVI and whether CABLIVI may be right for you.
Indication and important safety information. What is CABLIVI? CABLIVI, caplacizumab-yhdp, is a prescription medicine used for the treatment of adults and children 12 years and older with acquired thrombotic thrombocytopenic purpura, aTTP, in combination with plasma exchange and immunosuppressive therapy. Who should not take CABLIVI? Do not take CABLIVI if you've had an allergic reaction to caplacizumab-yhdp or to any of the ingredients in CABLIVI. What should I tell my healthcare team before starting CABLIVI? Tell your doctor if you have a medical condition, including if you have a bleeding disorder. Tell your doctor about any medicines you take, including medicines that increase your risk of bleeding, such as antiplatelets, thrombolytics, heparin, or anticoagulants. Talk to your doctor before scheduling any surgery, medical, or dental procedure. What are the possible side effects of CABLIVI? CABLIVI can cause severe bleeding. In clinical studies, severe bleeding adverse reactions of nosebleed, bleeding from the gums, bleeding in the stomach or intestines, and bleeding from the uterus were each reported in 1% of subjects. In the post-marketing setting, cases of life-threatening and fatal bleeding were reported in patients receiving CABLIVI. Contact your doctor immediately if symptoms of excessive bruising, excessive bleeding, or major bleeding occur. Signs and symptoms of bleeding include pain, swelling or discomfort, prolonged bleeding from cuts, increased menstrual flow or vaginal bleeding, nosebleeds, bleeding of gums from brushing, unusual bleeding or bruising, red or dark brown urine, red or tar black stools, headache, dizziness, or weakness. You may have a higher risk of bleeding if you have a bleeding disorder, i.e. hemophilia, or if you take other medicines that increase your risk of bleeding, such as anticoagulants and antiplatelet agents. CABLIVI should be stopped for 7 days before surgery or any medical or dental procedure. Talk to your doctor before you stop taking CABLIVI. The most common side effects in adults include nosebleed, headache, and bleeding gums. In children, the most reported side effects include nosebleed and rapid heartbeat. Tell your doctor if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of CABLIVI. Call your doctor for medical advice about side effects. Please see accompanying full prescribing information.